1. A nurse is caring for a patient with left-sided heart failure who is experiencing dyspnea at rest, crackles in both lung bases, and pink frothy sputum. Which action should the nurse take first? Administer prescribed diuretic. B. Elevate the head of the bed. C. Notify the healthcare provider. D. Apply oxygen via nasal cannula. Answer. Elevate the head of the bed. Rationale. Elevating the head of the bed improves oxygenation by promoting lung expansion and reducing pulmonary congestion, which is the immediate priority in a patient with acute respiratory distress. 2. A patient with heart failure has gained 4 pounds in the last 2 days and reports increased ankle swelling and fatigue. Which nursing action takes priority? A. Review dietary intake. B. Encourage ambulation. C. Assess lung sounds. D. Notify the healthcare provider. Answer. Assess lung sounds. Rationale. A rapid weight gain may indicate fluid overload and worsening heart failure. Assessing lung sounds will help determine the severity of fluid retention and risk for pulmonary edema. 3. A nurse is delegating care for a stable heart failure patient to an experienced LPN. Which task is appropriate to delegate? A. Initial patient education about low-sodium diet. B. Evaluation of patient response to diuretic therapy. C. Monitoring daily weight. D. Adjusting oxygen flow rate. Answer. Monitoring daily weight. Rationale. LPNs can monitor and report objective data such as daily weight, which is essential in tracking fluid status in heart failure patients. 4. A nurse is prioritizing care for 4 heart failure patients. Which patient should the nurse see first? A. A patient with a BNP level of 300 pg/ml. B. A patient with a potassium level of 3.1 milliequivalent/L. C. A patient reporting mild fatigue. D. A patient with a heart rate of 96 bpm. Answer. A patient with a potassium level of 3.1 milliequivalent/L. Rationale. Hypokalemia can precipitate life-threatening arrhythmias, especially in patients on diuretics. This patient is at highest immediate risk. 5. A patient with heart failure is prescribed furosemide, which finding requires immediate intervention. A. Serum potassium of 4.0 milliequivalent/L. B. Blood pressure of 116/78 mmHg. C. Tinnitus and decreased hearing. D. Urine output of 1,500 milliliters in 24 hours. Answer. Tinnitus and decreased hearing. Rationale. Tinnitus may indicate ototoxicity, a serious side effect of furosemide, especially with high doses or rapid for administration. 6. A nurse is teaching a patient with heart failure about fluid restriction. Which statement indicates a need for further teaching? A. I will use a small cup for drinking fluids. B. I will record all fluids I drink during the day. C. I can drink unlimited water as long as I don't feel swollen. D. I will suck on ice chips if I feel thirsty. Answer. I can drink unlimited water as long as I don't feel swollen. Rationale. This statement shows misunderstanding. Heart failure patients must restrict fluids even in the absence of visible swelling to prevent fluid overload. 7. A nurse is assessing a heart failure patient who has jugular vein distension, ascites, and peripheral edema. These findings are most consistent with which type of heart failure? A. Left-sided. B. Systolic. C. Right-sided. D. Diastolic. Answer. Right-sided. Rationale. Right-sided heart failure leads to systemic venous congestion, resulting in signs such as JVD, ascites, and peripheral edema. 8. A patient with chronic heart failure is prescribed spironolactone. Which lab value is most important to monitor? A. Sodium. B. Potassium. C. Calcium. D. Magnesium. Answer. Potassium. Rationale. Spironolactone is a potassium-sparing diuretic and can cause hyperkalemia, which must be closely monitored to prevent cardiac arrhythmias. 9. A nurse is evaluating a heart failure patient's understanding of discharge instructions. Which statement by the patient requires follow-up? A. I will weigh myself every morning. B. I will take my medication even if I feel better. C. I will avoid eating canned soups and processed meats. D. I will drink at least 3 liters of water a day. Answer. I will drink at least 3 liters of water a day. Rationale. Heart failure patients are typically on fluid restrictions. This statement contradicts the usual management for fluid overload. 10. A patient with heart failure complains of sudden weight gain and difficulty breathing. The nurse notes crackles and an S3 heart sound. What is the best nursing diagnosis? A. Impaired gas exchange. B. Risk for injury. C. Imbalanced nutrition. D. Acute pain. Answer. Impaired gas exchange. Rationale. The presence of crackles, S3 heart sound, and dyspnea suggests pulmonary congestion and impaired gas exchange, which is the priority issue. 11. A nurse caring for a heart failure patient notes urine output of 200 milliliters over the past 8 hours. Which action is most appropriate? A. Increase oral fluid intake. B. Administer an additional dose of diuretic. C. Notify the healthcare provider. D. Reassess in another 8 hours. Answer. Notify the healthcare provider. Rationale. Oliguria may indicate reduced renal perfusion due to decreased cardiac output, requiring immediate medical attention. 12. A patient with acute decompensated heart failure is receiving 4-furosemide, which finding suggests effective treatment. A BP 88/60 millimeter of mercury. B. Weight gain of 2 pounds. C. Crackles in both lower lobes. D. Decreased dyspnea on exertion. Answer. Decreased dyspnea on exertion. Rationale. Improvement in respiratory symptoms indicates that the diuretic is effectively reducing fluid overload. 13. Which statement by a newly licensed nurse regarding heart failure patient care requires correction? A. I will encourage the patient to walk as tolerated. B. I will increase sodium intake to maintain BP. C. I will monitor daily weight. D. I will assess for signs of fluid overload. Answer. I will increase sodium intake to maintain BP. Rationale. Sodium should be restricted in heart failure to reduce fluid retention. Increasing sodium is contraindicated. 14. A nurse is supervising an unlicensed assistive personnel, UAP, caring for a patient with heart failure. Which task should the nurse intervene on? A. Recording intake and output. B. Assisting the patient with bathing. C. Administering oral medications. D. Weighing the patient. Answer. Administering oral medications. Rationale. UAPs cannot administer medications. This task is beyond their scope of practice and requires licensed personnel. 15. A heart failure patient receiving digoxin reports nausea and blurred vision. What is the nurse's priority action? A. Give a next dose as scheduled. B. Check the patient's digoxin level. C. Increase fluid intake. D. Educate on medication adherence. Answer. Check the patient's digoxin level. Rationale. Nausea and visual disturbances are signs of digoxin toxicity. Levels must be evaluated before administering more. 16. A nurse is caring for a patient with heart failure on a low-sodium diet. Which meal selection by the patient indicates understanding? A. Canned vegetable soup and crackers. B. Grilled chicken with steamed broccoli and brown rice. C. Deli meat sandwich with pickles. D. Macaroni and cheese from a box. Answer. Grilled chicken with steamed broccoli and brown rice. Rationale. This meal is naturally low in sodium and appropriate for a heart failure diet, unlike processed or packaged foods. 17. A heart failure patient is prescribed enalapril, which finding requires the nurse's immediate attention. A. Cough. B. Blood pressure of 100/70 mmHg. C. Serum potassium of 6.2 milliequivalent/L. D. Mild dizziness. Answer. Serum potassium of 6.2 milliequivalent/L. Rationale. Hyperkalemia is a life-threatening side effect of ACE inhibitors like enalapril and needs immediate intervention. 18. A nurse is caring for a patient with left-sided heart failure. Which assessment finding supports this diagnosis? A. Jugular venous distension. B. Hepatomegaly, C. Crackles and lung bases. D. Peripheral edema. Answer: crackles and lung bases. Rationale: left-sided heart failure leads to pulmonary congestion, manifesting as crackles on auscultation. 19. Which instruction should the nurse emphasize when teaching a patient how to monitor heart failure at home? A. Measure heart rate weekly. B. Weigh yourself at the same time every morning. C. Check blood pressure only when symptomatic. D. Restrict fluids to less than 4 liters daily. Answer: weigh yourself at the same time every morning. Rationale: daily weights help detect early fluid retention, which is a critical indicator of worsening heart failure. 20. A nurse is reviewing medications for a patient with heart failure. Which combination of drugs should prompt further evaluation? A. Furosemide and digoxin. B. Spironolactone and potassium chloride. C. Lisinopril and carvedilol. D. Metoprolol and aspirin. Answer: spironolactone and potassium chloride. Rationale: both medications increase serum potassium levels, posing a significant risk of hyperkalemia in heart failure patients. 21. A nurse is caring for a patient with heart failure who has developed orthopnea. Which intervention should the nurse prioritize? A. Restrict fluids. B. Encourage coughing and deep breathing. C. Place patient in high Fowler's position. D. Provide a low-sodium diet. Answer: place patient in high Fowler's position. Rationale: orthopnea is a sign of fluid overload causing pulmonary congestion. High Fowler's position improves lung expansion and oxygenation. 22. A patient with heart failure is receiving 4-morphine for pulmonary edema. Which therapeutic effect should the nurse expect? A. Increased heart rate. B. Vasoconstriction. C. Decreased preload and anxiety. D. Increased respiratory rate. Answer: decreased preload and anxiety. Rationale: morphine decreases venous return and anxiety, which improves oxygenation and reduces the work of breathing in pulmonary edema. 23. A nurse is preparing to discharge a patient with heart failure. Which statement by the patient indicates effective teaching? A. I will stop taking my medication if I feel dizzy. B. I will rest after meals to conserve energy. C. I should avoid weighing myself too often. D. It's okay to eat salty snacks occasionally. Answer: I will rest after meals to conserve energy. Rationale: resting after meals helps reduce cardiac workload in heart failure patients. Other statements reflect misunderstandings. 24. A patient newly diagnosed with heart failure is anxious and expresses concerns about long-term outcomes. What is the best nursing response? You shouldn't worry so much. B. You may want to speak to a psychiatrist. C. Let's talk about your concerns and what can be done to manage them. D. You'll be fine if you take your medications. Answer: let's talk about your concerns and what can be done to manage them. Rationale: this response promotes therapeutic communication and supports patient-centered care. 25. A patient with advanced heart failure has cool extremities, confusion, and oliguria. What is the nurse's best interpretation of these findings? A. Mild dehydration. B. Medication side effect. C. Decreased cardiac output. D. Peripheral neuropathy. Answer: decreased cardiac output. Rationale: these are classic signs of poor perfusion due to inadequate cardiac output in advanced heart failure. 26. A nurse is teaching a group of heart failure patients about lifestyle modifications. Which recommendation is most appropriate? A. Take long walks daily. B. Weigh yourself weekly. C. Use salt substitutes freely. D. Avoid NSAIDs unless approved by your provider. Answer: avoid NSAIDs unless approved by your provider. Rationale: NSAIDs can worsen heart failure by causing fluid retention and should be avoided unless specifically ordered. 27. A patient with heart failure has a sodium level of 128 milliequivalent/L. What is the most appropriate nursing action? A. Administer hypertonic saline. B. Encourage sodium intake. C. Restrict fluids. D. Notify the dietary department. Answer. Restrict fluids. Rationale. Hyponatremia in heart failure is often due to dilution from fluid retention. Fluid restriction helps correct sodium levels. 28. A nurse is evaluating the effectiveness of discharge teaching for a patient with heart failure. Which behavior demonstrates correct understanding? A. The patient avoids all exercise. B. The patient eats bacon daily. C. The patient tracks symptoms and weight daily. D. The patient increases fluid intake during hot days. Answer. The patient tracks symptoms and weight daily. Rationale. Monitoring weight and symptoms helps detect early signs of decompensation, which is essential in heart failure management. 29. A patient with heart failure is started on carvedilol. Which assessment is most important before administering this medication? A. Respiratory rate. B. Urinary output. C. Blood pressure and heart rate. D. Bowel sounds. Answer. Blood pressure and heart rate. Rationale. Carvedilol is a beta blocker that can cause bradycardia and hypotension. Vital signs must be assessed before administration. 30. A nurse receives shift report on 4 patients. Which patient should be assessed first? A patient with heart failure and 3+ pitting edema. B. A patient with a dry cough and fatigue. C. A patient with orthopnea and pink frothy sputum. D. A patient who gained 2 pounds in a week. Answer. A patient with orthopnea and pink frothy sputum. Rationale. This presentation indicates acute pulmonary edema, which is a life-threatening complication of heart failure. 31. A nurse is preparing to teach a heart failure patient about energy conservation techniques. Which statement should be included? A. Climb stairs whenever possible to strengthen your heart. B. Do all activities in the morning when you're strongest. C. Take short naps before physical activity. D. Group your activities to allow rest between tasks. Answer. Group your activities to allow rest between tasks. Rationale. Spacing activities with rest periods helps prevent fatigue and preserves cardiac energy in heart failure patients. 32. A heart failure patient is receiving digoxin and furosemide. The nurse should monitor for which critical electrolyte imbalance? A. Hypernatremia. B. Hypokalemia. C. Hypocalcemia. D. Hypermagnesemia. Answer. Hypokalemia. Rationale. Furosemide causes potassium loss, and hypokalemia increases the risk of digoxin toxicity, requiring close monitoring. 33. A nurse is caring for a heart failure patient who is on oxygen therapy. Which observation requires immediate intervention? A. Oxygen flow rate is set to 2 liters per minute via nasal cannula. B. Patient reports dryness in nostrils. C. Oxygen tubing is kinked under the bed. D. Patient refuses to wear the nasal cannula. Answer. Oxygen tubing is kinked under the bed. Rationale. A kinked oxygen line can impair oxygen delivery and exacerbate hypoxia, which is dangerous in heart failure. 34. A nurse is caring for a patient admitted with decompensated heart failure. Which lab value is most indicative of the patient's current condition? A. BNP 50 pg/ml. B. Hemoglobin 11.8 g/dlc. Creatinine 1 milligrams per deciliter. D. Potassium 4.2 milliequivalent/L. Answer. BNP 950 pg/ml. Rationale. BNP is released in response to ventricular stretch and volume overload. A high level suggests active heart failure exacerbation. 35. A patient with heart failure reports severe fatigue, and the nurse notes pallor and a hemoglobin level of 8.5 g/dl. What is the best nursing action? A. Provide oxygen therapy. B. Encourage iron-rich food. C. Notify the healthcare provider. D. Encourage rest and fluids. Answer. Notify the healthcare provider. Rationale. Severe anemia can worsen heart failure symptoms and may require medical intervention, such as transfusion. 36. A nurse is teaching a patient with heart failure about fluid restrictions. Which technique is most effective for compliance? A. Using large cups to track fluid. B. Encouraging family to monitor fluid intake. C. Filling a measured pitcher with a day's allowance. D. Avoiding counting ice cream or soups as fluids. Answer. Filling a measured pitcher with the day's allowance. Rationale. This visual tool helps patients monitor and control their total daily fluid intake. 37. A patient with chronic heart failure is prescribed a beta blocker. Which patient statement requires clarification? A. I might feel tired at first, but that's expected. B. I will take this medication with food. C. This medication will help my heart beat more strongly. D. I should not stop this medication suddenly. Answer. This medication will help my heart beat more strongly. Rationale. Beta blockers decrease heart rate and workload. They do not increase the strength of heart contractions directly. 38. A patient with heart failure is admitted for fluid overload. Which dietary instruction is most appropriate? A. Use broth-based soups for hydration. B. Choose frozen dinners for convenience. C. Season foods with lemon juice and herbs. D. Snack on salted nuts for added calories. Answer. Season foods with lemon juice and herbs. Rationale. This approach enhances flavor without adding sodium, aligning with a low-sodium diet for heart failure patients. 39. A nurse notes that a heart failure patient has developed an S3 heart sound. What does this finding indicate? A. Dehydration. B. Valvular stenosis. C. Volume overload. D. Normal aging. Answer. Volume overload. Rationale. An S3 gallop in adults is a classic sign of fluid volume overload associated with heart failure. 40. A patient with heart failure has a heart rate of 52 BPM and is taking digoxin. What is the nurse's priority action? A. Give the medication with food. B. Hold the medication and notify the provider. C. Administer half the dose. D. Check the blood pressure before proceeding. Answer. Hold the medication and notify the provider. Rationale. Bradycardia is a potential sign of digoxin toxicity. The medication should be withheld and the provider contacted. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.